kind of the take-home message is the bar is very high to take someone's rights away. As all of you have kind of seen in the news about Britney Spears, she had presented this statement about what she's been through in the last 13 years with her conservatorship, the degree to which her conservatorship has been influencing all of her, not just financial and legal decisions, but also decisions about her reproductive health. She had mentioned that she has an IUD that she would like removed, that she would like to have another child and get married, and that the conservatorship is preventing her from doing that. And so, having heard that, myself as a gynecologist and many other physicians became, very concerned and a little bit confused about the degree of control that her conservatorship is exerting over her. And so, since I heard that story, I really wanted to discuss this with a mental health expert or somebody who knew a little bit more about how someone comes to be in a conservatorship, the limits to the control that they may have over someone's decision-making capacity and the decisions that they make about their own bodies, and the influence that has on kind of bigger questions about bodily autonomy and reproductive rights for people who have mental illnesses or disabilities. So just a little bit of a caveat, obviously, Dr. Metzger and I are both not attorneys. We can't comment on sort of the legal aspects of her case. And then obviously no one knows the details of Britney's own medical condition. So we're not going to conjecture. We're not going to try and guess, what her medical conditions or mental health conditions may be. Dr. Metzger is a psychiatrist and an author, and she's also a professor of psychiatry at Emory and Morehouse and the Medical College of Georgia. And the reason I wanted Dr. Metzger to come on and explain some of these stuff is because psychiatrists are the medical professionals who are asked in these cases to make a determination about decision-making capacity. Our first question is, what are these conservatorships and how might a patient come to be in a conservatorship?
Yeah, well, first of all, I know I was looking at your post and you said like in your 16 years of practice, you've never seen this extreme.
No.
And I've done things where I've had to test capacity and determine if somebody's able to make their own medical decisions, but never have I seen it this severe. Usually we decide to do something like this. So it's basically somebody getting guardianship and they're the ones able to make your medical decisions. But in them making your medical decisions, they also have a little bit of, contribution in terms of your reproductive rights as well. So that's a really touchy subject. But so the times that I've seen it is either it's really in like severe dementia when people have to for their parents and, in terms of their decision to drive or their medical decisions. But I've also seen it with like severe developmental delay. So specifically, I was thinking about Down syndrome because that's sometimes what we really have to like make the decision of doing Depo-Provera or doing some kind of implant because of the risk of what could happen if they were to get pregnant. So I've never seen it to this extent, but usually it's basically guardianship where somebody is so impaired that they're not able to make their own medical decisions and also their decisions for things like pregnancy and to build a family. But not in this age. I've never seen it in this age.
Absolutely not. And that's what I was kind of getting at with the post is I have never seen a young person who is, like Dr. Metzger was saying, like usually it's in cases of severe dementia, somebody who's older, or in these really, really significantly impaired patients who are essentially like non-communicative, like people who have to live in a residential facility where they have 24/7 nursing care because they can't, get places by themselves. They can't, kind of care for themselves on a day-to-day basis. Definitely not in a young person who is able to make like a public statement about what she's going through and perform in live shows, like, very complex choreography. It's just so unusual. The few times I've seen it in a patient that I've cared for is someone who is almost either they can't communicate and they have literally like a medical aid that travels with them constantly because they can't, get places by themselves. In those cases, we do sometimes like for, medical reasons, like we would do things like, like long-acting birth controls because of concern of, if somebody was raped or became pregnant, obviously they can't consent to sexual activity, or because they're having such, distress from bleeding with their periods.
Right. I mean, I was thinking about in patients I've worked with like severe schizophrenia and and one thing, and also even in bipolar disorder, where mania can be compared with hypersexuality and where people are more like just be having unprotected sex and having children. But even in those cases, we've never gotten to the point where we had to do that. At that point, the patient still has autonomy and we're able to teach and say, I don't think it's the best idea. We want you to be safe. But I've never gotten to the point where we've had to have parents or the next of kin really get involved in terms of making that decision for them.
Absolutely. Something interesting that kind of came up in the discussion, and let's say like the TikTok that I made addressing this topic, is a couple of people were like, well, she's making bad decisions, and if she, gets pregnant by this guy, it's he's going to take her money. I kind of wanted people to understand this bar is really high for someone to have the decision-making capacity taken from them. It's not just that they're going to make bad decisions or do something foolish. It's just not. Yeah. Go ahead.
All would need one. And I think the thing with Britney is we look at the level of functioning, right? So she was able to have this high level of function. To be an entertainer takes a lot of work, and it takes a lot of, working and performing and rehearsing and following a schedule. So she was able to get to this point in life, not by herself, in terms of she had to have the ability and that intellectual functioning to get there. So we look at past history as well. So, from our perspective, this is somebody who's high functioning. Of course, there was a really, tough time that she went through 2007, 2008, around that time. But just based on her history, still, even if you have a really bad break and you have a hospitalization, that's not enough for us to say, okay, it's time for us to look into seeking guardianship. It's just not enough. We have to look at kind of the whole lifespan, and really the level of functioning is very important.
That is so important. That was another thing that came up in the comments was, well, she had this situation, she had a mental break of some sort, and so they had to take over because she was going to make poor decisions. Like you said, even if someone is temporarily, like if they're hospitalized because of some sort of urgent, like mental health emergency, it doesn't then become that they have an indefinite limitation on their rights and decision making.
It's not a stamp. That's why when I heard, I think 13 years, I was like,
13 years. Yeah.
Possible, something you reevaluate. It's not like a stamp and then you say this is forever, because there are cases who are able to regain capacity, let's say after head injuries, and they're able to make their own medical decisions and just be able to function on a daily basis. So there are cases that it is temporary. So we don't look at it as it being a permanent document. It's something that can be evaluated.
Can you talk a little bit about things like hospitalization? So people kept using the example of, when she had this emergency, what are the circumstances kind of in that context that someone may temporarily be, hospitalized against their will?
Right. So there's certain examples where somebody can be hospitalized against their will, and we call that like an involuntary hospitalization.
Yes.
Meet the criteria, either you're a threat to yourself, so meaning like you're expressing suicidal ideations, especially if it's with a plan that's considered to be very severe, or you're a threat to others. Like if you're threatening to harm somebody else, threatening to kill somebody else, or you've actually done physical harm to somebody else. And the third one is just simply an inability to take care of self. So to go to work and just not even showering for days, no longer eating, just an inability to really do the basic things to stay alive. Those are three categories of when you can be involuntarily hospitalized. The thing is, a document really only lasts for 72 hours. So in Georgia, we call it a 1013 here. Like in Florida, they call it the Baker Act. Once you do that, is that you can keep somebody to be evaluated for 3 days in the hospital. And then the doctor who's in the hospital can make the decision if they want to continue the involuntary hold or if they can be discharged after that time. So even in that example where somebody is that sick, it still is temporary. It's still a 72-hour kind of period where you can be evaluated, and then we can make the decision. I was trying to kind of figure out how many times she's actually had a psychiatric hospitalization. I wasn't much, but it's usually something where, I've had patients who've been hospitalized 10 times within a year. So usually it's something pretty severe. It's not like a one and done, oh, you've had involuntarily hospitalized and now we can seek guardianship. That's not how it works. It usually is something that's a pattern.
I was just about to ask that, because even if someone's repeatedly hospitalized, like it was something that it's not the first time even that they're hospitalized, even then it doesn't sort of spark this legal kind of process. And so kind of what circumstances does something like this conservatorship kind of come about? Is it something where a family can request it as like a legal review? Like how does that even happen?
So it starts off with a legal thing. So usually they talk to the patient's provider. So usually it's the psychiatrist first and saying, listen, they've been hospitalized a lot. We want to see if we can seek it. And then what we do is we do something where we evaluate capacity. So we're really evaluating just like certain things we look at is just like, do you know what year it is? Do you know where you are? So we do basic like orientation questions, and then we get into really higher level of thinking and just asking questions just about the psychiatric history and, just making sure that the thinking is where we want it to be. And then even if we do that, it's still another legal process. So it's not something like a psychiatrist makes a decision and then that's it.
Mhm.
That's why I was surprised that it was even able to be thought of as an option so soon. And
Exactly. And so ongoing, like the 13 years later that it hasn't been reevaluated or reassessed. I mean, it just seems so unusual for it to be so long. Yeah.
right. And, you know, and it's interesting because the mandates I was reading about her having to work and do all of this, it's like, it's interesting. It kind of almost is kind of going against what it should be.
Exactly. It doesn't make any sense. It's like you are so incapacitated that you can't make your own decisions, but you can be functioning at an
Right.
incredibly high level and working and earning money and performing and doing these complex, processes. Like it absolutely kind of contradictory.
Yeah,
So,
for people who can't leave
yeah.
their homes, they are not able to work, you know, they don't have the intellectual like capacity to work. This is not for somebody who can get up and do 4 Vegas shows. It's almost like one should have canceled the other out.
One of the other things that she mentions being forced to take lithium. She didn't want to be on lithium. She felt it made her really sedated and confused. And so, what are the circumstances that someone could be forced to take medications, psychiatric medications that they don't want to take?
So once again, I've worked in community psychiatry for 8 years where I like probably half of my patients don't want to take medicine. So this is
Mm-hmm.
something that is not easy to do. It is not something we usually have to have a 2 doctor consent. Only really on an inpatient basis are we even able to do it. I haven't ever been able to do it as an outpatient doctor. So
Mm-hmm.
it's something that you can only do in the hospital with 2 doctor consent. And
Yeah.
you forensic patients, so patients who are like, they're based on legal proceedings. I've never had a patient that I've been able to force medications as an outpatient doctor. As a matter of fact, I've had parents plead with me, like, please, is there a way? Because, especially with us, with psychiatry, we have things that are injections that you can just take once every 3 months, which can really.
Mm.
So I've had parents who said, please let them be able to take the shot. Please, please, please. But, I really have to talk about the ethics of it. It's like, as patient rights, if they say to me, I refuse to take it, even
Mm-hmm.
if, we know how much they need it, we can't. So, I've only seen this forced medication thing in the hospital with dangerous patients.
Inpatient setting.
Right.
Absolutely.
I have,
And the same thing for gynecology is even somebody who has like a legal guardian who makes their decisions, for instance, like pelvic exams, like sometimes, their inpatient facility or whatever will send patients to have like routine exams. If they are uncomfortable with it at all, we don't do it. Like even if the guardian says, oh, you should do this to them, like we won't. There's a certain level of where almost like it's like a battery situation where you can't force someone against their will to do something that they are expressing a disagreement with, even if there's like a legal guardian situation. So it takes a very strange set of circumstances for someone to say that like I'm being forced to take medicines I don't want to take. Like we can never, I always tell people like I can't go home with you and I can't like administer medications that you refuse to take. Kind of the take-home message is the bar is very high to take someone's rights away. The default is to ensure that a patient has autonomy. We don't have to agree with their decisions. We don't have to feel like their decisions are the best decisions. That's their decision to make. And this is for everybody. Like every, like legal adult walking around could make the world's worst decision ever. And
right.
we're not going to say, you have your rights taken away because you're going to do something foolish. Like that's just not how our medical and legal systems work. And
The thing I don't like about this case is that, people are already very hesitant to seek psychiatric treatment.
Mm.
And I believe that people see this, I'm like, oh my gosh, if I go and see a doctor about, my bipolar or my depression, then this is going to happen to me.
Mm.
And it's just, that's the only thing that, it's bringing up the discussion, but unfortunately, I hope it's not discouraging people from seeking treatment because now people are really fearful. They're like, wait, can that happen to me? Can people take away my rights because I'm taking an antidepressant? And so I'm glad to let people know that, no, this isn't real life. This is how things normally work.
Yeah, and that is so important for, and the reproductive rights too, that, so many of my patients have, some sort of mental health issue, depression, anxiety, bipolar, history of suicidal ideation or suicide attempt. It does not mean that you've lost your right to make decisions for yourself. And so it doesn't mean that you lose the right to decide that you want to have children later. Like that, it's not what we do.
I keep kind of, if I can go on the soapbox and like say this out from a speakerphone, a speaker, like, no. This does not mean you're going to lose your rights. If you go to a physician or you go to the hospital because of your symptoms, that is not the next step to take away. So I think that's huge because a lot of people, that was the questions that I was getting. Like, so wait, is that true? Like if I get hospitalized, can I be forced to work and take meds? No.
People did also mention kind of, like the associated issue of, people with disabilities, having very strict kind of guardianship situations where someone is making decisions for them, or even issues like forced sterilizations.
I've had circumstances where I've had like patients with developmental delay and they agreed, their parents suggested it and they agreed to go ahead and do, have sterilization procedures, but they never had it where they didn't want it and they were still forced to do it.
The vast majority of doctors, again, even if there was like a legal guardianship situation for things that are permanent, sterilizations, hysterectomies, or even like long-acting implantable like contraceptives, would really, really, really want to, make sure that as much as the patient is able to participate in that decision, to involve them, to really involve things like ethics committees, if there's any sort of controversy about whether this is the best thing for the patient. So, truly, like the times I've kind of polled a couple of other gynecologists about, have you had circumstances like this? And then almost always when there's a decision about things like sterilization and, hysterectomies, that we involve, ethics committees, it really, like legal counsel, like it's definitely not something that someone just decides for a patient. We take that responsibility very, very seriously. And then especially in light of, and this is something that came up in some of the comments, is, the history of forced sterilizations of disabled people or minority people or immigrants, in some places of the world, in some places in the United States, like has even been happening, in kind of like detention facilities. So that is something that almost all of us are very, 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 careful to not kind of go down that slippery slope of forcibly doing anything permanent to a patient that they can't, consent to.
Ethics in medicine is huge, and us making these type of permanent decisions, it's not something we take lightly. Thinking in terms of like, I know they said that she was forced to take an IUD. So after this, does that affect her fertility going forward?
So actually, some people ask that, like, one, kind of what might have happened when the IUD was first put in, and then number two, like, how long can it stay in? And so, obviously we don't know, like, under what circumstances she had it placed. She obviously could have, wanted the IUD back when it was placed, and obviously may have changed her mind since then. IUDs are, for the United States, FDA approved for a certain duration of use. Technically at some point, like, if you're following FDA guidelines, like, someone should be removing it at some point. But technically, I guess, if the guardian is refusing, we obviously can't do any sort of procedure without a consent. So it is a consentable process as IUD removal. It's very simple. You just sort of pull the string. And so, but it's considered a procedure. So it does require a consent to be done. So it is something that, as long as it's in there, in theory, it could be preventing her from becoming pregnant even beyond the FDA approval duration. So, people are saying, well, at some point, does it wear off? Like, what does it mean? If you leave it in place, like there are some IUDs in other countries that are meant to be permanent. So if you have a device in the uterus, in theory, obviously no one's, tested the ones from the United States. In theory, if you leave it in, it could be considered almost permanent sterilization. It could work forever. Somebody also brought the movie I Care a Lot, which is about someone taking advantage of, older patients and elder care. But that's actually a good point, that's probably another circumstance that much more commonly is abused. And so.
The reason I didn't like it is just because it's so accurate and scary that happen. So
Yeah.
it was just kind of just seeing how people could take advantage of the system.
So would OBGYN have needed patient consent even if the patient was under conservatorship? So technically we only need the consent of whoever is legally able to make decisions for the patient. So for instance, in circumstances for like a surgery, with a minor, so somebody who is, under the age of legal consent. So we technically only need the parents' consent and not the patient themselves. And so in these sort of legal guardianship cases, it usually is only the legal guardian who needs to consent. But again, in practice, pretty much always, if the patient is able to participate in any way, we try and involve them. So I personally always, if the patient is able to, understand the conversation and sign, like I'll still, like Dr. Metzger was saying, we still try and educate the patient. We still try and discuss and have them understand what we're doing, the reasons for it, the risks, the benefits. And so we still have that conversation. I know I personally still have them sign if they can. And so, it is legally only requiring the legal guardian, the conservator, but for kind of clinical purposes, we do try and involve the patient to whatever extent they can participate. That I almost forgot to ask is, people have said, like, will she have a chance of getting this reversed if she doesn't agree to be reevaluated? She was requesting to have it be discontinued, but not have to go through a reevaluation process. What was your thought on that?
The reevaluation, just for documentation, would need to be on record in order for us to do it. But for most cases, you would need a reevaluation just to have it of record for her current status. Yeah, and just a reminder that as a physician, we're the patient's advocate. It's not us against patients, and just kind of remembering that we're there to advocate for you and your rights. So I don't want this this case to bring on this us against the patients. No, we are your advocates to get you feeling better, and we only do this or even discuss this in a worst case scenario. And this, what we know of what Britney went through, would never have been something that in my practice that I wouldn't even discuss needing a guardian or having a concern.
Absolutely. Yeah, it is just incredibly strange. We do hope the best for her. I think everyone is kind of rooting for her, like all the doctors and, mental health professionals that I know that I've spoken with are really like this, from what we're understanding on the outside, seems extremely very strange, very unusual, almost unheard of. And we do hope that she is able to appeal and get her rights restored, and at least gets the chance to, get the court to give her that right. And so, well, thank you so much, Dr. Metzger. This is amazing. So she's, what's your social media handle again? Is it Dion Metzger, MD?
Yep, Dion Metzger, MD, DION. DGER, MD, and that is also for Twitter.
Thank you guys so much for your time. Dr. Metzger, for your time. You've been amazing. I've learned so much myself, and I hope you guys have a good night. All right. Take care. Bye.